Thermage has become one of my favorite go-to treatments for skin tightening, and I'm a firm believer in its results. In this video, I'm going to take a deep dive into Thermage, the mechanism of action and how it works, and why collagen as an extracellular matrix protein is so important in anti-aging and the aging effects of skin over time. From snatching the lower face, to lifting up on the jowls, to lifting up on nasolabial folds, to tightening neck skin, also to off-label body treatments for tightening abdominal skin, underarm skin. Whether you're curious about the science or the results, or if you want to see if Thermage is the right treatment for you, I've got you covered. And I'll show you some before and after so that you can see the effects that Thermage treatments have had on my own patients. So let's dive into the world of Thermage and how you can get skin tightening and rejuvenation of the skin without surgery. Hi, my beauties. My name is Dr. Stephanie Capel, and I'm a board-certified, double fellowship-trained cosmetic dermatologist in Newport Beach, California. And I've been in practice almost 20 years. And I wanted to provide a source of true and honest information on YouTube for you guys with non-sponsored content that's science-based and non-biased, because I feel that this industry is flooded with misinformation, clickbait education, sponsored content by YouTubers who don't even practice and actually see patients in their office. And I wanted to provide a source of truth and honest information so that you guys could make better informed decisions for yourself to have the best skin of your life at every age. And a lot of people may ask, Dr. Capel, what does fellowship trained mean? So after board certification in dermatology, once you complete a residency in dermatology, doctors can go through an extra 1, 2, or 3 years of advanced fellowship training where we just do cosmetics, lasers, injectables, energy-based device, and cosmetic procedures, and you're doing it proctored under world-renowned experts. You're logging in thousands and thousands of cases, so you could truly be an expert in the field of aesthetics. And if doctors don't put fellowship trained in their credentials, it's usually because they do not have fellowship credentialing, which is okay, but that's what I mean by fellowship trained, just in case you were curious. So what is Thermage? Thermage is what we call an energy-based device. And how is this different from lasers? Lasers are light amplification by stimulation of the emission of radiation, which is collimated photons in a coherent wavelength. In English, what that means is lasers are light-based treatments and light-based devices. Energy-based devices are in the category of like Thermage, soft wave, ultrasound, microfocus ultrasound, radio frequency, microwave, any energy that dissipates heat into the skin to stimulate the fibroblasts, which are the collagen-producing cells, to make more collagen, to lift, tighten, smooth, and pull the skin. That's different than lasers. So a lot of people will say, oh, is Thermage a laser? They're totally different, two different subclasses of devices that can be used in rejuvenation and in aesthetics, but they're two totally different mechanisms of action. So think energy-based devices as putting heat into the skin to stimulate collagen, and lasers are very focused, elegant wavelengths in a coherent wavelength that are targeted to a certain chromophore, so to do a certain job. Resurface the skin, get rid of fine lines and wrinkles, get rid of melanin, get rid of blood vessels, get rid of tattoos, get rid of hair pigment, get rid of hair. So lasers are more focused, and light-based devices and energy-based devices like Thermage are different. Now, Thermage uses heat in the form of radio frequency to stimulate collagen synthesis by the fibroblasts, the collagen-producing cells in the dermis, which is the second layer of the skin. Now, Thermage has been around for, almost since the early 2000s, for a really long time. And it's an FDA-approved skin tightening treatment that's safe for all skin types, regardless of your Fitzpatrick skin type color. And that makes it really universal and versatile. So it has been improved over the years. So people sometimes will say, well, Thermage has been around forever and there's a bright new shiny toy on the market and I want to go with that one instead of Thermage. But Thermage is like the iPhone. The iPhone 15, 16 is different than the iPhone 6 and 7. And so just keep that in mind, because there's constantly making updates on the platform and on the software to where the device is now a completely different device than it was in the early 2000s, back when I was still in medical school. And again, I'm making this video not because I'm sponsored by the company. I have no ties to the company whatsoever, but I do use it in my office day in and day out, and I have a lot of happy patients with very reproducible results. There's only one treatment that's needed, safe for all skin types, and it always delivers. So the reason why I like Thermage is because it puts heat in the form of radio frequency in the skin to stimulate collagen. Usually the most common areas treated are the lower face. We usually do it for a brow lift. We can do mid-face to lift up on the nasolabial folds. We could do it on the neck for neck tightening. And the protocol in which we do it in our offices may be a little bit different than other offices, but it's really important to have an astute clinician who understands the pharmacokinetics kinetics and how to use this device, understands the physics behind it, the pathophysiology behind what we're treating and how it works. Also, you have to have the most updated platform, the FLX platform, and when the updated platform comes along year after year, you have to keep continuing to update. I feel that there's a lot of Wild West industry medi spas out there that will try to save a buck by buying a refurbished old used Thermage device from 2005. That's where you get the complications like melting of your fat. It doesn't work very well, or they're spreading it too thin and using one 900 pulse tip, and they're using it from the top of the forehead to the neck. If you're spreading it out too thin, you're putting eggs in a basket. It's better to just kind of concentrate on the problematic area, say for example, lower face laxity and jowls, and just get it from the mid face to the right underneath the jaw in the submental area, the superior upper neck area, to kind of just put all your eggs, all the pulses, all the energy in that area to help snatch that area. So our protocol may be a little bit different, and the level of our providers in my office may be a little bit different, and the software is always updated. You'll never find old, used, refurbished devices in this office because we hold ourselves to a more elite standard, and you should too. Whoever you go to see for your treatments, ask about their credentialing, ask if it's the most updated platform. Where did you get your device? Did you buy it straight from the company, from Solta, or did you get it from some third-party laser broker, which happens a lot. We even have people coming to our office saying, hey, do you want to sell your device? Because what they do is they'll buy it from a provider, break it up into different parts, and sell it to different medi spas and kind of outsource different swapping of the parts of these devices, where you're basically using old refurbished machines that are going to achieve temperatures way too hot, melt the fat, cause atrophy, or not get results at all. Mix that with a provider who's not highly trained, and then you're going to get complications. So it's really important to make sure that you go to an astute clinician, updated software, ask them where they got the device from, because if you're paying money and you're trusting a provider with your face, don't be afraid to challenge them with these questions. Most people that end up in my office have done a lot of research to get to me, and I love it when they ask me questions. How long have you been doing this? Where did you do your training? Where did this device come from? And I welcome it and I love it. So don't feel afraid or embarrassed to ask your provider, where the device came from and where they got their training, how long they've been doing this, what's your, how long have you, been providing this treatment, and where did you get your device from? Because those are really important questions. And if you're trusting them with your face, and you want a low complication risk, and you're paying a lot of money for these treatments, you want it to be worth it. So don't be embarrassed or shy to ask your provider. Also, if it's at a very low price, you have to sometimes question why. Was the overhead for their device not that much? Is their level of training not superior? Is that why their prices are a little bit lower? So always ask, shop around, get a second and third opinion when looking for treatments for skin tightening, regardless of your provider. So immediate and long-term results. When you do Thermage, you're putting the heat into the skin, and that does two things. First of all, it cross-links existing collagen tighter, so you will see immediate tightening effects. Sometimes when we do one side of the face, I'll hand my patients a mirror so they could compare the untreated side to the treated side, and you see kind of an immediate tightening, but the real magic happens months later. Usually 2 to 3 months after the treatment, you'll have stimulation of new collagen production by the fibroblasts, the collagen-producing cells. So you do get a little immediate tightening and cross-linking of existing collagen, but you get production of new collagen, which is where the real magic happens, because that's when you see the lifting, the tightening, the pulling of the lower face. I keep referring to the lower face, but it could be brow lift, it could be lifting up nasolabial folds, it could be tightening abdominal skin after having babies. And you see that about 2 to 3 months later, and it keeps progressing with respect to better and better results for up to 12 months after the treatment. Now, some providers will say, oh, you need a treatment every 6 months. I say that that's a red flag. I love empowering you guys. I love educating you guys. I can't help medi spas and unethical providers from charging people and doing bad things, but what I can do is empower you guys. I can't stop them from what they're doing. It's the Wild West in aesthetics these days. But what I can do is empower you guys to know what to ask for and know when something is a red flag. I never recommend Thermage less than 1 year after treatment. You can do another area, but you don't want to repeat the same treatment less than 12 months because you're still getting the results from the first treatment, 10, 11, 12 months after the treatment. So why would you get another treatment? It's like going to the gym when you're still sore. You need to recover all the way and then hit it again at the gym to get the best, most bang for your buck. It won't hurt you, but I feel like it's just a waste of time and money because you're still getting results from that initial treatment 12 months or less before. So the long-term results of Thermage are amazing. Let's just say this. I've done it 4 times. I'm 47 years old now. I did it at age 30, 35. Stephanie, my amazing laser nurse specialist who's in this office and does this procedure in my office on my patients, did me way back then, 30th birthday, 35th, 40 and 45. And it's one of the best things that I've done so far. I kind of fell off the wagon when I had babies and I had 2 kids under the age of 5, and I kind of slacked a little bit. If you look at my older YouTube videos when I'm in my 30s, I look a little haggard, and then I shaped up when I was, I think, 40, 41, and I did another Thermage treatment, and we did thread lifts and a bunch of other fun things, but I'll do a whole other video on that later. But Thermage has honestly been a godsend to me because it's kept my skin full of collagen, and it has just helped me maintain, a youthful jawline, brow lift, and especially mid-face with nasolabial folds as well. I've also done under my eyes, which, we'll come to it later on in this video, but under eye Thermage is a great treatment for keeping the collagen stores in that under eye infraorbital area, which is the first to show our age because we start to lose collagen there even in our early, late, mid-20s, because when we start to smile, those lines start to form. But when you increase upregulation of collagen synthesis and you have increased collagen in that thin, delicate skin, that gives that structural support and trigger to smooth textured skin to help smooth fine lines and wrinkles and to keep the under eye area nice and tight. So the benefits of Thermage for collagen banking, especially in our 30s and 40s, is that you're increasing your collagen stores. So as we lose 1% of collagen each year or 10% of our collagen each decade, you're building up your reserves. You're staying ahead of the curve and you're being preventative and proactive. And that's the true meaning of anti-aging. So whether you're, in your 50s or 60s or 70s and you're trying to reverse the signs of aging, or you want to be preventative and kind of build your collagen stores so that as you lose collagen each decade, you're staying ahead of the curve, and that's the true meaning of anti-aging. It benefits everyone. So Thermage is a treatment that I recommend for everyone of every age, of every skin type, and also male and female. So it's a pretty universal treatment for everyone. So areas I've treated personally include my lower face, which is probably the area that I've been most obsessed with, my neck, and my forehead. I've only done a brow lift for forehead maybe once or twice. I think actually probably twice. And every other area I've done 4 times, including my lower eyelids. And now I never did an upper eyelid Thermage because I did have an upper eyelid blepharoplasty when I was 41 years old. Again, I'm 47 now, but I did do under eye Thermage. Under eye Thermage requires a special handpiece. The handpieces are different because depending on the thickness of the skin, you have the transducer, which is the handpiece of the device, and there's an arc of radio frequency that goes through. So there's like an arc that goes at different depths. In the eye skin, you want that arc right into the dermis, the papillary and reticular dermis, and the eyelid skin is thinner, so it's a smaller tip. And then you have the mid-face treatment, which is a bigger tip because that arc of radio frequency goes deeper. It goes a little bit deeper to affect the skin because the dermal thickness is deeper in different areas of the face. So the under eye treatment with a smaller handpiece also requires an intraocular eye shield. Now, a lot of providers will say, oh, we don't do Thermage near the eye. Let me translate that for you. They probably don't know how to put in an intraocular eye shield. So someone who's not very well versed in aesthetics wouldn't have gone through the training. If someone knows how to put in an eye shield, they're pretty well versed in aesthetics. So that could be kind of a red flag secret question that you can ask your provider. Do you guys do lasers? Do you do CO2 under the eye? Do you do Thermage under the eyelids? Oh no, we don't do it there. Do you know how to put in an eye shield if you really want to be sassy? But I really think that if you're going to trust a provider with your money, your face, and your health, you should not be afraid to ask these types of questions. To put the intraocular eye shield in, it's not a big deal. It took me probably about a year to learn how to really get good at it, and I did it on my ophthalmology laser rotation, and we did it on pediatric patients, and I got really good at it, but I did go through a lot of training to do what I do in this industry. And part of that training was learning how to put in intraocular eye shields, especially when we're doing lasers on babies with port wine stains and congenital malformations and things like that. You basically put some numbing drops into the eye so the globe of the eye is nice and numb. You gently insert an eye shield. And again, you want to go to the right provider who knows what they're doing, because if you use a laser eye shield on a Thermage patient or vice versa, you could basically fry the eye, and we've seen it happen, knock on wood. These are the things that you see, the good, the bad, the ugly, the dirty on the horrible side of things from unauthorized, untrained providers doing things that they shouldn't do and they're not trained to do. So the intraocular eye shield is a plastic, usually a black intraocular eye shield. That's different than like a laser or a fractal intraocular eye shield, which is a silver metal protective eye shield. A metal eye shield in a Thermage patient is going to conduct all the radio frequency and fry the eyeball. So be sure you go into somebody who knows what he or she is doing. We put in the eye shields. It's very comfortable for the patient. We have you remove your contact lenses if you're a contact lens wearer. And then after the eye shields come out, we put some saline artificial tears. You blink a couple times and your eyes kind of come back to life because they've been numbed from the tetracaine or the numbing eye drops. And then after that, we have you avoid rubbing your eyes for about 24 hours and avoid contact lens use after 24 hours of having the eye shields put in place. But it should not be painful. The procedure should be very quick and easy and painless. We usually do it under the eyes. If you're a patient of mine, you want to drop a comment in the comment section and tell everyone it's not painful and it's not too hot, it's not uncomfortable, and we never use numbing. That's the other thing. You don't want to use numbing cream or numbing injections to have a Thermage treatment because you want that biofeedback from the patient. If it's too hot or too warm or uncomfortable, you have to let your provider know, because when you inhibit that, you're putting the patient at risk for fat atrophy, melting of the fat, and achieving temperatures that are too high to achieve the goals that we're trying to achieve of skin tightening. So ideal candidates for Thermage are people who don't want to have surgery, but just want to have an improvement and tightening of the skin. Or if they want to be preventative and increase their collagen stores to have a proactive approach to anti-aging at a younger age, like I did when I was younger, and now I'm reaping the benefits of it now that I'm older. So everybody, I think, could be a great candidate for Thermage, especially if you want to avoid surgery. Again, it won't prohibit you from having surgery in the future. I know a lot of plastic surgeons these days are not staying in their lane and they're trying to act like dermatologists, even though they're board certified and trained and have done 7 years of residency to do surgery and plastic surgery. They try to become dermatologists and say, don't do Thermage or any non-surgical treatment. You need to be in the OR. You need to do surgery. They're also operating and doing facelifts on 35-year-olds. And I don't agree with that, because I do think Thermage is a beneficial treatment that won't preclude you from having surgery later on. And I can speak as a dermatologist and as a dermatologist and also as a dermatologic surgeon who I did Mohs micrographic surgery for 2 decades or almost 2 decades of my life, and we do transposition flaps and grafts and undermine and subsize, and we move around tissue and do facial reconstruction. And I've done most of my Mohs surgical cases and cosmetic surgical cases on patients who have had Thermage, Sculptra, and all of these treatments that are non-surgical that plastic surgeons often say, well, you can't have this because then you'll never be a surgical candidate. And I just don't believe in that fear-mongering. I think it's unethical. It's going to increase collagen, which is a type of scar, but that scar tissue will never impede you from being a good surgical candidate. And I can speak again as a surgeon and as a non-surgical dermatologist as well. And in my opinion, somebody saying, oh, this non-surgical treatment is going to induce scar tissue so you can't be a candidate for surgery later is fear-mongering, and it's unethical, because scar tissue, you guys, scar tissue is increased collagen. If you burn yourself on a stove or on an iron, you get this thick keloidal plaque-like skin, or you get hypertrophic scar. There's a bunch of collagen in it if you look under the microscope. But with Thermage and Sculptra and Retin-A and lasers, what they do is they induce collagen stimulation, which is essentially a form of scar, but you can also look at it as increased collagen stores, and that's what everybody's trying to achieve in anti-aging. It's not the type of scarring that's going to inhibit you from being a candidate for moving around the SMAS, the subcutaneous tissues, the skin. Trust me, I operate on people who have had Thermage and Sculptra and all these non-surgical treatments when I do skin cancer surgery, and it's different. And even some, cosmetic procedures and surgeries that I do. So just keep that in mind. So this takes me to debunking myths about Thermage. Will Thermage make me not a good surgical candidate later on in life? And the answer is no. Another myth that I hear is, I'm too old to have Thermage. I can't stimulate collagen anymore. Remember, I always say this, skin is a very dynamic, responsive organ system. It responds to stimulus. So if someone hasn't been taking care of their skin and they're 70 years old and they decide to start wearing sunscreen, get a laser treatment, and start Retin-A or tretinoin, their skin will transform. Those cells are responsive to stimuli. Now, they may not be as responsive as a 15-year-old, but you can definitely induce changes in the skin. You can upregulate collagen synthesis, especially as our cells become dormant and sleepy and kind of lazy over time. Doing Thermage will help stimulate it to make collagen like it did several years before. And that's the true meaning of anti-aging and rejuvenation. You can stimulate collagen at any age. Now, with that said, if you do collagen stimulating procedures earlier in life, you'll be more responsive to subsequent treatments. Just as a 50-year-old who goes to the gym for the first time is going to maybe not get as much out of a workout as a 50-year-old who's been, an athlete and training since she was 20 years old. And so you have muscle memory and you have conditioned stimulus responses. And I feel that if you do Thermage earlier in life, say a 70-year-old comes in for Thermage and she did it when she was 60 and she did it when she's 50, she's going to be more responsive to that treatment. But that's not to say that a 70-year-old who's never had any collagen stimulating treatments won't respond to Thermage. They may just not get as big of a response as someone who's done it in the past. The reason for that is that the collagen type that gets stimulated by Thermage is collagen type 3. Collagen types 1 and 5 are abundant in the skin, and wounds and babies and children have more collagen type 3. It's a more youthful type of collagen. That's why when I squish my daughter's cheeks, I'm just like, oh, look at that type 3 collagen. And the type of collagen that gets stimulated by these types of treatments is collagen type 3. You also get 1 and 5 as well, but type 3 collagen and the collagen that gets stimulated has a lower melting point, meaning it's more responsive to subsequent treatments, especially heat-based treatments. And so that's the mechanism of action in that phenomenon. And that's why starting earlier is usually more beneficial, but that's not to say if you've never done it that you're not going to respond to a treatment. Now, another myth is that Thermage is going to melt my fat, or Thermage isn't going to work, or Thermage is going to thin my skin. And those are untrue. Now, the first myth, I'm not going to say is not true, because you can have fat atrophy and you can melt the fat with 3 different scenarios. You have an untrained provider who does not know what they're doing, didn't go through the appropriate training, doesn't understand the physics of how the machine works, doesn't understand histology of the skin, the depth, the temperature, the impedance, and understands all the settings. They just kind of went to a crash course and like, oh, I'm going to buy Thermage, from a laser broker for, a third of the price of the updated platform. I'm going to use an older device and I'm going to charge less because I have no idea what I'm doing. I'm using this old technology, but I'm going to open a Medi Spa because I'm a retired pediatrician and I want to get into aesthetics. That's the situation where you're going to have your fat melt. An older platform, which wasn't bought from the company, which was refurbished with swapped out parts to lower the overhead or the cost of the office for having that, that platform, having an untrained or unskilled provider who doesn't understand, the temperature ranges that you have to be in and understanding the biofeedback of the patient, and then also using numbing. We never use numbing in our office for Thermage. The only caveat is if we're doing thermofrax because we need numbing for the Fraxel, and usually we'll do the Thermage without the numbing, then we'll put the numbing on the patient, and then we do the Fraxel. But even so, sometimes we'll use anesthetic for the Thermage if we're going to be doing Fraxel. But again, we're using the updated platforms and we have very highly trained providers in our office performing these procedures. So fat melting is something that, knock on wood, we never see. And the risk for fat atrophy is using numbing, unskilled providers, and old refurbished machines or older software and older platforms. Remember, there's a certain range and temperature window that you have to be in to stimulate collagen. And there's a different range that gets into fat melting territory. It also has to do with the depth of the arc of radio frequency that's going through the handpiece transducer. So if you're too deep, you're going to be melting fat. If you're too hot, you're going to be melting fat. So understanding that range of window in order to be in a safe zone to where you're going to stimulate collagen and not melt fat is really important. But also the newest updated platforms don't allow you to achieve temperatures too hot to melt the fat. So that's really, really important. That's why it's really important to get the most updated platform, because a Thermage device in 2024 is a lot different than the Thermage device in 2005. So once you have a Thermage treatment, again, you'll have a little immediate cross-linking. You'll see your skin tightening, but about 2 to 3 months later is when you really notice the results. I remember the first time I did it on my lower face and neck, I was getting my hair done and I was in the shampoo bowl and I was like, whoa, that was tight. And I remember my fiance was 6'4" and I was trying to lean up to give him a kiss, and it was like tight. I was like stretching to try to give him a kiss. So you'll feel a little bit of tightening. When you move your head, you'll feel a little bit of tightening as well. That's when you first start to see the results, and then it continues to improve to up to 12 months. Results from Thermage last about 5 to 6 years. The half-life of the collagen that gets stimulated is about 5 to 6 years. Now, if you're 30 years old, you could probably go 5 to 6 or maybe even 10 years before your next Thermage treatment. But say you're, 73, 75, and you're aging at a little bit more rapid pace than someone in their 30s. It's not that your Thermage didn't last that long. It's just your upkeep and stimulation of collagen has to be upregulated a little bit more. Your frequency frequency of treatments may be, 1 to 2 years instead of 5 to 10 years. So it just depends on your age. It depends on many other factors, other collagen stimulating treatments that you're doing, if you do laser resurfacing, if you use a tretinoin, if you're using medical grade skincare, and things of that nature too. I also tell people after Thermage, it's really good to upregulate, because your skin's upregulated to make collagen. Give your skin the building blocks to make collagen. So doing, collagen peptides and supplements, increasing your collagen building blocks in your diet through supplements or through diet is really important too. If you want to refer to my video about collagen and different supplements that you could take, it's a great video to kind of refer to as well. Okay guys, hopefully you enjoyed this video and answered all your questions about Thermage. We'll see you next time.